This is Radio Health Journal. I'm Reed Pence. This week, okay, I'm vaccinated. Now what? Can I finally get rid of my mask?
Certainly by the end of the summer, and I really have reasonably high hopes that we can have a near normal Thanksgiving.
The reality of what being vaccinated means when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
One of the things that can be really destructive isn't so much what you say. If you say it with contempt or disgust or disdain, that real dismissing way, that's one of the things that can be pretty dangerous.
How do you handle conflict? Then,
sometimes when things like this happen, we're like, oh, I'm a loser or oh, I'm a failure. But I think the idea is that, no, you're a human being and, you make decisions the best you can and you're constantly learning.
The value of grit in life. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
More than 60 million Americans have been vaccinated against COVID-19, and the pace is accelerating, with 3 vaccines now available. But a lot of those immunized people, while they may be feeling pretty lucky, would also like to know just what does vaccination mean? What can I do now that I couldn't do before? And what can't I do? It's a little more complicated than a simple checklist of do's and don'ts, and it involves some judgment calls on your part. To come up with a good answer, it helps to know exactly what the vaccine does in the body. Dr. Niket Sanpal is assistant professor of clinical medicine at the Touro College of Medicine.
What vaccines do is they trigger our immune system to create antibodies. Those antibodies, in the first dose, start to become produced acutely, meaning in the short term. And then over time, different types of antibodies are produced, known as memory antibodies, that are going to last us a lifetime. The idea of 2 doses is to push the concentration in our bloodstream of antibodies high enough so that if we have an encounter with the COVID-19 virus, those antibodies will neutralize the virus and remove it before it can actually hijack one of our cells and use that cell to create copies of itself like any virus does. Therefore, what ends up happening with the actual vaccine is it either prevents you from having COVID-19 or it prevents you from having a very, very severe course of COVID-19.
The big thing that everybody's heard about the first 2 vaccines is that they're 95% effective. That figure is vastly superior to vaccines for almost any other viral disease. But it's important to know, 95% effective at what?
Basically what it means is that it has a 95% chance of preventing or reducing and essentially neutralizing COVID-19 in your bloodstream. Now, what that means is we don't want people to get a false sense of security. The vaccine does not mean that you can go out and not wear a mask, not wash your hands. You can start to mingle again and, do all the things that we did before COVID changed the world permanently. What it means is that you still have a chance of contracting COVID-19. You still have a chance to get sick.
If you meet a person spreading the COVID-19 virus, that chance with a vaccination is about 5%. The measure of a vaccine's effectiveness is its ability to prevent serious illness, but it may vary in a lot of people, according to Dr. William Schaffner, professor of preventive medicine and infectious diseases at the Vanderbilt University Medical Center.
They're 95% effective. Did I say 100%? No, I didn't. I said 95. So let's still be careful. And remember, everybody who's vaccinated doesn't get to that 95%. There are going to be people who are frail, who are immunocompromised, who clearly get protection. We don't know exactly how much, but it may not reach 95. So if you're one of those especially frail people with underlying immunocompromise, for whatever reason, drug treatment or the nature of your illness, you will still want to be very careful. And then this whole issue of whether you can still get infected and be without symptoms, but then pass it on to others, is not yet completely resolved. So we haven't started to give out those get-out-of-jail-free cards. We would ask you to keep wearing the mask until we let you know that the data are really solid.
This is one of the vaccine's aspects that concerns people most. Can a vaccinated person still harbor the virus well enough to spread it to someone else, even if they don't get sick themselves?
Although you're vaccinated, if you encounter the virus, can you become infected and be without symptoms and thereby be able to pass it on to others? We're not entirely sure yet, but the data are accumulating slowly but surely that these vaccines also diminish your chance of becoming infected and passing it on to others. The data are not complete, but it's looking very optimistic.
It's very similar to those who are asymptomatic carriers. The percentage of those people is a little hard to define, but because they themselves did not have it. You know, the tree falls in a forest and no one's there to hear it, did it even fall? Same exact idea. If these individuals who are asymptomatic or asymptomatic because of the actual vaccine, are they spreading? There's still a lot of data that has to be mined and figured out with this, but there is a theoretical concern that they could still spread the infection.
However, it's also true that if a person is vaccinated, theoretically their immune system should reduce what's called their viral load.
By viral load, we mean that if I encounter the virus and the virus infects me, these vaccines will have provided enough protection so that even if the virus multiplies a little bit in our bodies, the amount of virus that I will shed, that I will be able to put out into the environment, is much diminished, and therefore that means I'm much less likely to pass the virus on to my neighbors.
In the rush to approve COVID vaccines, the original data analysis didn't include that aspect. Preventing serious disease was the big objective and the basis under which the vaccines were approved. But Schaffner says the data on disease transmission shouldn't be long in coming.
These were secondary studies that were done in the trial. We're starting to get information from these analyses. We haven't buckled it all up yet, but the information would indicate, so far we're on the right track. There are early data to suggest that the vaccine also prevents a substantial amount of potential transmission to others. But since we don't know that for sure yet, please keep wearing your mask and doing the social distancing. I don't think it'll take much longer. And what do I mean by much? Well, a few months before we can blow the all-clear whistle, or, to mix metaphors, hand out those get-out-of-jail-free cards and we can say, okay, you can stop wearing your mask. We're not there yet.
So where does that leave you if you want to see your grandparents, who you haven't seen in a year, but who have now been vaccinated? Can you do that? Schaffner says there's no yes or no answer.
I remind them that the grandparents, first of all, at best, got 95% protection. Then the question is, the people who are going to visit those grandparents, how careful have they been in everyday life? Have they been wearing the mask, social distancing, and the like? Because if the answer is yes, well, sure, they can visit. And then the question is, how carefully do we behave during the visit? Do we take off our masks? Do we keep distant? Are we allowed a quick hug and a kiss and then step back? It all depends on how meticulous you want to be and how carefree the visitors have been in everyday life.
Other scenarios are similar. Things like traveling on an airplane or going to dinner in a restaurant with another couple and you've all been vaccinated. Are these activities okay? Well, it depends how careful you are and what you yourself think of the risk.
Much depends on your own risk tolerance. Some people are very, very careful. Others are not quite as careful, and you'll have to decide for yourself. After all, the notion is we want to prevent disease in ourselves and we don't want to give this virus to anyone else.
One complicating factor is the variants of COVID that are circulating. They provide plenty of reason to be careful and keep wearing a mask. But as Schaffner would say, stay tuned.
This British variant in particular is much more contagious, and the data are now coming in from Britain that it may actually cause more severe disease. Now, we're in pretty good shape regarding this British variant because masking, social distancing prevent its acquisition also, and the vaccines that we currently use seem to be effective against this variant. So I don't expect that this variant is going to cause a great surge in infections. That South African variant bothers me more. It's the most different from the standard strain. And if that one becomes more common in the U.S., that's one I'm more concerned about.
So how much should it change your life if you get the vaccine? Right now, Son Paul says, not that much.
There is a misconception that the vaccine makes you impenetrable. And no vaccine makes you impenetrable. It makes the ability to contract the virus significantly lower, and it's to protect you from, if you do get sick, from having a severe course. But remember, this virus is not just about protecting ourselves, it's protecting our neighbor. That's why masks, hand hygiene, social distancing, and all of those steps we've taken still have to stay in place, because we have to get 80% at least of the population, obviously we want to get everyone vaccinated, to achieve herd immunity. What herd immunity means, it's essentially the analogy of a pinball machine. You've got 10 spots where the pinball can hit. If 8 out of 10 don't work, then the 2 that are working are less likely to be tagged by the pinball. If that happens, those 2 people who are quote-unquote unvaccinated won't get the virus.
However, we're at a danger point right now. The vaccine will enable us to get back to normal eventually. But Son Paul says if we throw away our masks too soon and get rid of all social distancing and other precautions, we could get another spike.
Hospitals are overrun right now. There are a lot of institutions that are very, very stock full. Doctors, healthcare workers, nurses are exhausted. They've been fighting this for over a year. So when people get the vaccine and they drop all the previous measures we have, there's a chance that we could see a spike in infections, and therefore we don't want people to get a false sense of security because we don't want the hospitals to be overrun again.
And don't get the idea that we're done with masks forever after this. In fact, Schaffner believes it's the exact opposite. Thanks in part to masks, this has been a record low year for the flu. Last season, the CDC says nearly 200 American children died of the flu. This year, only 1. It may provide some lessons.
Now that we've gotten used to them, at least to a degree, I think we'll hear more public health recommendations for those people at risk of the serious complications of influenza. Hey, you may want to think about wearing a mask and social distancing, because that will, in addition to flu vaccine, protect you against flu as well as COVID. So we won't be like countries in the eastern part of the world where those people wear masks during influenza season on a routine basis. But we've now been introduced to masks.
That, however, is a worry for next fall. And the good news is that Schaffner believes by then we can travel. We can see Grandma and have dinner out and not worry about it much at all. And those masks, gone.
I'm not ready to say, as some very optimistic predictors have suggested, that we could put our masks aside by April, but certainly by the end of the summer. And I really have reasonably high hopes that we can have a near normal Thanksgiving.
You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence.
Two nationwide surveys find that discrimination is a significant barrier to care for people with Alzheimer's and dementia. Half or more of non-white Alzheimer's caregivers report they face discrimination in navigating health care for their recipient. Dr. Carl V. Hill is Chief Diversity, Equity, and Inclusion Officer of the Alzheimer's Association.
The data suggests we have a long way to go to address lack of health equity in healthcare. More than 80% of non-white racial and ethnic groups say it's important for Alzheimer's care providers to understand their backgrounds and experiences. But fewer than half of Blacks and only about 60% of Hispanics and Asian Americans feel confident about their access to culturally competent providers.
The surveys also reveal a lack of trust among Blacks in research clinical trials, and half doubt that advances in Alzheimer's treatments would be shared. These findings are part of the 2021 Alzheimer's Association Facts and Figures Report. Find out more at alz.org/facts.
Limited availability of COVID-19 vaccines means testing will remain important for work, travel, and preventing disease spread. A recent national survey shows widespread confusion about COVID-19 testing. Less than a third of people surveyed know the difference between PCR-based and rapid antigen-based technologies, and more than half say it doesn't matter what kind of test you get. Dr. Manoj Gandhi, Senior Medical Director at Thermo Fisher Scientific, which commissioned the survey, says accuracy doubts could keep people from being tested at all.
Nearly two-thirds of those surveyed believe COVID-19 tests can be wrong as much as half the time. PCR tests are designed to detect SARS-CoV-2 with high sensitivity. Understanding when to use PCR tests is imperative to knowing your COVID-19 status and safely getting back to life's routine activities.
Nearly 3/4 of Americans say they'd choose a COVID-19 test with the most accurate results, even if they have to wait a little longer. Find out more at covidtestinginfographic.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It's actually a highly effective procedure for 80% of people. And I think that's sort of the glass half full side of the story.
Knee replacements. Patients can be miserable when they don't work, but how often is that?
Then the story of Elizabeth Blackwell, the first woman doctor in the U.S.
Most people's reactions to her are outrage, disgust, shock.
All that and more on Radio Health Journal.